All right, well, joining us on the line to shed more light on this outbreak, we're very pleased to welcome the Minister of Health himself, Dr. Motsoaledi. Minister, a very good afternoon to you. Thank you so much for joining us. Please help us understand how Listeria is actually contracted and spread.
Good afternoon, Alicia. Good afternoon to the viewers out there. Yes, indeed, Listeriosis is a disease transmitted by a bacterium called Listeria monocytogenes. And as you have already said in the clip, the bacteria is widely available. It's found in soil, in water, and in vegetation. And it will infect you if you eat food which might have been contaminated from those sources I've just mentioned.
All right. Now, Doctor, we hear that the reported figures indicate so far that about 30 people have already died from this disease. But just how severe, according to the department, is this outbreak? Should we be really worried here in Gauteng in particular?
You see, there are conditions under which you call a disease an outbreak. You don't just say because people are affected by disease, some have died, is an outbreak. You check. The reason that we finally agreed with the World Organization and the National Institute of Communicable Disease that this is an outbreak is because annually, for the past 40 years annually, our hospitals in the country, both public and private, see between 60 and at most 80 patients per annum with the disease. And that's why it has not been a problem. But this year, we have already reached a figure of more than 500 even before the end of the year. That's why then we thought it is definitely an outbreak.
Minister, we hear that we heard in the insert package there that those most affected, of course, are the newborns, the pregnant women, and of course those with weakened immune systems. But is it preventable and curable? How would you even know if you've been exposed?
Yes, indeed. The people who have mentioned, all of them have got weak immune systems. Newborn babies do not have an immune system because they need to acquire it. That's why it's more prevalent in newborns, in neonates, the first 28 days of life. Pregnant women, all pregnant women have got lowered immunity. The elderly get infected by many diseases because they also have lowered immunity. Then the other people is because of illnesses, which lowers their immunity, like people living with AIDS, people who have got diabetes mellitus, people who have got cancer, and people who have got chronic disease like kidney and liver disease. Ordinarily, it can infect anybody, but those groups, as mentioned, are the ones who are very prone to this illness. And yes, it's preventable if you obey the 5 keys to food safety. The 5 keys have been determined by the World Organization that in a food-borne disease, for you to prevent it, you need to obey those 5. The first one is to keep clean. Wash your hands with soap and water before handling food and after handling food. And don't get tired. I emphasized this morning that don't ever get tired of washing with soap and water and say, but I've already washed. If it means washing more than 100 times a day, please do it. Please do it. The second one is when you are handling raw food, don't at the same time touch cooked food already. Please separate them. If you happen to touch raw food before you touch cooked food, wash again with soap and water. The third thing is to cook food thoroughly. Never eat food that is half cooked or uncooked. If you have to eat food that does not need cooking, like for instance fruits and some vegetables, you need to clean them thoroughly with clean running water before you ingest them. And lastly, use safe domestic water. People who don't have clean running water have to cook that water before they use it. Same as milk. Use only pasteurized milk. If there's no pasteurization, make sure that you boil the milk before ingestion.
All right, Doctor. And of course, we hear that the CDC in our insert package as well, they're saying that they could be expecting more deaths. But do you tell us what is being done, particularly by your department, to try and curb the spread, the outbreak rather, from spreading, and also provide the necessary assistance to those affected? Is there relevant information out there? Can people go out to clinics to test? Because I'm sure if you've contracted the disease through food, you wouldn't necessarily know that that food was contracted.
Indeed, Alicia. For members of the public, the NICT has issued an emergency operation center number,
yes,
which unfortunately is only for working hours. It's at 011 386 2000. That's the number which members of the public must use if they happen to be suspicious. But for health workers who might be confused by symptoms, there's also a hotline for clinical emergencies after hours, 082 883 9920. 082 883 9920. In addition, the Department of Health is producing some pamphlets, and documents so that people usually ask questions can actually be answered through those documents.
Yes. All right. And doctor, we hear that it's easily treated with antibiotics, of course, but you have to catch it on time. Where can people get the necessary advice on how to actually go test and get more information about this, besides the numbers that you've given? Can they go to the clinics around the country and go have themselves tested if they suspect?
Oh, yes. What you are advising, yes. The disease is treatable with an antibiotic called ampicillin.
Okay.
Definitely treatable. And it's not even resistant to ampicillin. But the problem is it is virulent. In other words, it's a treatable disease, but which is very angry.
All right.
If I may put it in such simple terms. So if you go to any clinic, obviously they ought to be able to advise you. If the health worker is confused, they'll phone those numbers I've given for health workers. But
Okay.
any clinic and hospital can be able to help.
All right. And doctor, when you mentioned that the health practitioners themselves could be confused by the symptoms, what are the symptoms that one could look out for them to have the urge to actually go and test further if they have been exposed?
There are three types of things that can happen to you when you contract Listeria. One, you can have flu-like symptoms, ordinary flu-like symptoms, fever, headache, general body pains, joint pains, weakness, sometimes with nausea and vomiting and diarrhea. That's number one. Number two, you can get a very serious condition called septicemia, where your whole blood system is infected and poisoned. Number three, you can get what you call meningoencephalitis, where the brain and the brain membranes are infected.
All right, Minister, thank you so much for that live update. That is, of course, the Minister of Health, Dr. Motsoaledi, on the line to us, and he was giving us more information on the outbreak of listeriosis. And, of course, the numbers provided to us there, 011 385 2000, for anybody who suspects that they might have been exposed, and for healthcare practitioners that might be confused by the symptoms, the number there to dial, which is a 24-hour number, 082 883 9920. If you go on the SABC News online website, I'm sure you're going to find those details there. Do go and have yourself tested.